The member from Kitchener-Waterloo.
Thank you. Speaker, my question is to the Acting Premier. Today's FAO report is unequivocal in its findings. The government plans to reduce program spending is happening across most areas. Planned spending growth in health and education, for example, is about half the rate it should be in order to keep up with population growth and other cost pressures. According to the report, this means that program expenses would need to be $4 billion higher by 2018 and 19 compared to what was written in the 2016 budget. Mind you, this is only if the status quo remains, and Ontarians know that the quality of public services under this Liberal government only continues to decline. My question, how long are Ontarians expected to go without?
Minister of Finance.
Minister of Finance.
Thank you, Mr. Speaker, and I appreciate the question. I also appreciate, as I've mentioned, the work done by the FAO in this regard, recognizing how important it is for us to take note of the fact that the structures in place, the status quo, must be amended without sacrificing the very services that are important to Ontarians, like health care and education. It's one of the reasons we're investing much more in health care, $1 billion alone this year, as well as $12 billion over the next 10 years to support new hospitals and new hospice cares and new services for the people of Ontario when it comes to health care. The FAO also makes reference to the fact that we are coming in balance. He also notes some of the risks that are involved that we must address, and we are doing just that. It's also why we've built in quite a bit of prudence into the system. But the member opposite is asking a very important question, a question being, can we stay the way we are, or must we make the appropriate changes to improve our services while being mindful of the taxpayers as we proceed forward and balancing the books at the same time?
Mr. Speaker, this government likes to congratulate itself on having the lowest program spending per person in the country. But Ontarians know what that means. They are living a painful Liberal reality in Ontario. They know it means less money for health care. Our hospitals are already overcrowded, as we've heard. It means less money for education. Kids with special needs are already not getting the supports they need. And more money is spent cleaning up Liberal mistakes. All in all, it simply means less money for the things that Ontarians depend on, the people that we're supposed to be working for, the people that we are elected to serve. My question is simple. When will this Liberal government put the needs of Ontarians first?
Thank you. Minister of Finance.
Mr. Speaker, I'm very proud on this side of the House that we have been putting Ontarians' needs first every budget that we've presented that I've had the pleasure of doing. And I must admit, I have to ask the member opposite this very question. On page 9 of her platform, they promised to make $600 million in unspecified cuts every year. This member opposite stood and said that the way to find the savings, the way to make those cuts is in health care, by our own admission. We're not doing that on this side of the House, Mr. Speaker. We're investing more than health care. We're providing for the people of Ontario.